Hi, this is Dr. Ronald Prane. I'm a sleep dentist up in the Woodlands around the metro area of Houston, Texas. This video is to explain to you how snoring can be dangerous. It's something that everybody thinks that, I snore, my grandpa snored, my dad snored, no big deal. Basically, it's not my problem, it's my bed partner's problem. They're the ones who have the problem. I'm fine, I sleep well, everything like that. Well, I'm here to tell you that there's some newer research coming up that's showing that actually snoring can be dangerous to your health and could even be life-threatening. Let me explain to you what snoring actually is. Snoring is caused by a high velocity of air going through your throat. Why would the air be going high velocity? Because the tongue falls back and starts to obstruct your airway. Like that. Your tongue starts to make your airway more narrow, and when your airway becomes more narrow, you have to put higher velocity to get more air in there. The high velocity air causes the walls of the airway to start to pull in negative pressure. The vibration of the walls of the airway is what actually causes the noise of the snoring. We used to think it was that little uvula back there, that little thing that dangles down. We thought that was it, so they used to cut them off, but we knew that that didn't work very well. The problem is the airway walls are starting to collapse and vibrate intensely, causing the snoring noise. Now, is that a bad thing? Yes. We have found that it causes microtrauma to the tissue, which makes it more inflamed and more able to actually, sometimes it shuts down. It closes the airway. That's called apnea. But you don't know this is going on because you're asleep, okay? So the increased turbulence also causes sore throats in the morning. It causes inflammation in the nasal cavities, leads to more sinus problems and nasal problems. The vibration has been shown, and this is the new research with the Doppler artery studies that they've shown, is that the vibration causes plaque buildup in the carotid arteries. You know what that means. Plaque can be dislodged and give you strokes. In fact, they're now saying that those TIAs, those mini strokes people can have, is actually caused by snoring. That was happened to my father. So the snoring is actually very dangerous because you have a 65% increase in chance of stroke. Now, the other problem with snoring is that it causes sleep to become fragmented because you can't get the deep sleep, because every time you go in the deep sleep, your brain arouses you to breathe better, because you can't increase your effort and you can't increase your ability to breathe with all the snoring because in the deep sleep, because it's just impossible. They can't do the both at the same time. So you get all these what they call arousals into the higher levels of sleep. So your sleep becomes fragmented. That leads to several problems. One is it makes you fatigued during the day. You may hit that wall at 3 o'clock in the afternoon and you either suck it up or get through it or drink some caffeine or something. But the fragmentation of sleep can lead to blood sugar problems. It can lead to obesity. It can lead to type 2 diabetes, they're finding now. The increased pressures in trying to get your airway open leads to high blood pressure. And of course the risk of stroke. So all these things are little things that are little signs that you check off, can be individual problems if you just say, I got a little high blood pressure, or my blood sugar is creeping up, or I'm just getting old and fat, no big deal. Well, yeah. The problem might be is that you have a sleep disordered breathing problem, and snoring is just one of the symptoms of many. And so I strongly urge you to get it checked out. If it turns out just to be a little bit of snoring, then hey, we have dental appliances that actually stop snoring. If it turns out to be more of a dangerous situation, we have dental appliances that can help you with that as well. But we need to do a sleep study at that point. But the first step is to get it checked out. Call your sleep doctor. If you're in this area, give us a call and we'll be happy to check it out for you. What harm would it do? It may even save your life. Thank you.